Once surgery is completed and you're taken to the operating room, the surgeon will go out and speak to whoever's waiting in the family lounge, and then you'll be placed in the recovery room. Once in recovery room, you'll be awake, you'll be talking, especially if you've had spinal anesthetic. If you've had spinal anesthesia, you will initially be numb from your nipple line down, and as it wears off, the nurses will check to see where your spinal level is at that time. So as you wake up and you're wheeled into recovery room, they may be asking you to wiggle your toes, can you feel me touching your legs, things of that nature. And if you've had general anesthesia, you'll start hearing them talking to you as you're waking up in recovery room. You will still have your IV fluids running. Every patient will have oxygen on, and you'll also have an oxygen sensor on your finger that lets the nurses know that you're getting enough oxygen. Every patient will have compression stockings or compression boots on their feet, and this helps prevent blood clots from forming. Anytime you've had surgery and you're not as mobile as usual, you are at risk for developing blood clots, but we do everything we possibly can to prevent those from happening. So you will have a little device on your feet that fits like a slipper that has tubing on the end of it that hooks up to a machine that sits at the bottom of your bed. These cause a pumping motion that helps promote circulation. These will only be worn while you're in bed and while you're in the hospital. When you're up sitting in the chair and you're ambulatory walking around, these foot pumps will come off and they will not go home with you. In recovery room, you may experience some nausea. This is very common from movement. It could be from the anesthetic, and it could also be from the narcotics that we're giving you for pain. We have a protocol that we follow for every patient, but we also realize that every patient is an individual. So although we have a protocol, you may have specific needs that other patients may not have. So please let us know how you're feeling. We will do everything we can to treat you as an individual and treat your needs on a specific basis for you. Most patients after surgery are going to start experiencing some discomfort because you've just had major surgery. The pain that you've experienced before surgery will be gone and will now have some surgical pain. The nurses will ask you frequently on a scale of 0 to 10 how you rate your pain, 0 being nothing and 10 being the worst. It is our goal to get you around a 4 or 5. We expect you to feel some discomfort but still be comfortable enough that you can participate in therapy and take rests throughout the day and have a good night's sleep at night. Your pain medicine may be given in multiple different ways. You may receive some pain medicine right through your IV that the nurses can give to you, and you may have some multimodal pain remedies ordered for you. We may give you Tylenol around the clock. We may give you some anti-inflammatories post-operatively for a short period of time, and we may give you some narcotics automatically, and then some narcotics as needed on an as-needed basis. So we will be in constant communication with you as far as how your pain control is, and the nurses, like I said, will ask you frequently on a pain scale of 0 to 10 how your pain is. And our goal for asking that is to see that if you rate your pain a 10, that we're getting that pain down to a 6 or to a 5 so that you're a little more comfortable to be able to participate in therapy. Most patients stay in recovery room for about an hour. And then, like I said, everybody recovers differently. So once your room is ready for you to come down to, after that hour time frame, you will be brought down to the surgical care unit. We can do some minor heart monitoring in the surgical care unit, so if that is something we require, you still will come to the surgical care unit. If you have a more significant heart history or need to be monitored a little bit closer, you may spend the evening in our telemetry unit or intensive care unit before coming down to the surgical care unit. You will always end up on the surgical care unit before discharge. Once you come down to your room, you'll be greeted by a nursing assistant and or a nurse that will take you back to your room to introduce you to your surroundings. They'll show you how to work the television, your call bell, and the telephone. And depending on how you're feeling and how early your surgery was, you may or may not get out of bed that first evening. Some patients just feel like dangling at the bedside. Some patients feel like sitting in the chair, and some are actually able to take a walk to the door and come back. So everybody is different, and depending on how you're feeling will guide us in how we treat you that first night. Every patient will be encouraged to change positions every 2 hours, just so that you don't get stiff or sore from being in one spot. We will initially start you on some clear liquids just to make sure that you're tolerating them fine. And as well as you do, will instruct us on how quickly we can advance you. So if you're doing fine with clear liquids, we'll advance you to a regular diet. We'll get you back on all of your medications you were on at home and start anything new that the physician may have ordered for you. Your oxygen will remain on that first night. And as I said, you may or may not experience some nausea, but please let us know. We have tons of medications that we can give for the nausea as well as for the pain. After your first night, the next morning physical therapy will begin, usually with occupational therapy the first time to do your initial evaluation. Once you've been up with therapy and you're getting around and you're not experiencing nausea, you're on a regular diet, we will discontinue as many things as we possibly can for you to make you feel better and have it easier for you to participate in therapy. We will take your IV fluids down, take your oxygen off, and take that Foley catheter out of your bladder. We will gradually get you to walking into the bathroom to use the restroom. And physical therapy will have you doing therapy in the room, out in the hallway, and also in the PT gym where you can go up and down steps before discharge. Each day will gradually get better for you. The first day is always the hardest day, but each time you get out of bed will get increasingly easier for you. The more that you move, the better that you'll feel. So the first day you will get out of bed twice a day, and that will continue every day throughout your hospital stay. Whether it's a weekday or a weekend, you will have therapy twice a day during your stay. 50% of our patients go directly home, and others will go to a facility for more rehab prior to going home. Every day that you're in the hospital, the nurses will go over how to bathe and care for your incision. It's cleaned with soap and water, and they'll give you instructions on how to care for that at discharge. We encourage you to drink plenty of fluids while in the hospital and also at home. Your medications can be a little constipating and you're not moving around as usual, so we will put you on a stool softener that you will take automatically twice a day every day, but it is not a laxative. So please keep something on hand at home for discharge so that this does not become a problem for you. The nursing staff will be in your room at least every hour checking on you, if not more. We do hourly rounding to ensure that our patients are comfortable and safe. They will make sure that you have all of your restroom needs taken care of, that you're able to reach everything safely, and that your pain is at a comfortable level every time that they check on you. We have a very multidisciplinary approach that we take with our patients. You will be introduced to a case manager and social worker that will follow your whole case while you're in the hospital, and along with your case manager or social worker, physical therapy, occupational therapy, and your nursing staff will all come up with a safe plan in conjunction with your physician for discharge. Thank you for listening. I hope you have found this beneficial. I wish you all luck in your surgery. If you have any further questions, please refer to your binder that was given to you in the physician's office or contact your physician.